Hey guys, Dr. Paul here. Now, tooth whitening is an awesome thing. It's easy, quick, it's affordable. It's a great way of improving the overall look of your teeth. The problem though is it can be confusing. Is it safe? What's the best way of doing it? How long does it last? There's a lot of things to know. So in this video, and it's going to be a long one, I'm going to cover absolutely everything that you need to know about tooth whitening. So first off, we're going to talk about how and why whitening works. Now, teeth tend to go yellow over time for a variety of reasons, but the main one is that they start to stain. This staining can be extrinsic, so on the outside of the tooth, or intrinsic, which is on the inside of the tooth. So extrinsic staining, it's the staining you'll see on the teeth of someone who drinks a lot of tea, for example, or they smoke a lot of cigarettes. It covers the outside of the tooth. Now, intrinsic staining is where certain colored molecules will actually embed themselves inside of the tooth. Now, whitening works by removing the extrinsic staining by mechanical action, or by removing the intrinsic staining inside the tooth by breaking down these molecules using a peroxide bleaching gel. So first off, we'll talk about the extrinsic staining. So as I mentioned, this is removed by mechanical action, and it's as simple as going to the dentist for a clean for them to actually remove the staining for you. And it's also where some of those toothpastes fit into it. So charcoal toothpaste and whitening toothpaste, these guys, they actually have an abrasive in them that while you brush your teeth, that abrasive helps remove that extrinsic staining. Now, unless you're someone who has a lot of staining on the outside surface of your teeth, these toothpastes don't actually do a great job at whitening. The other thing is that they can cause some sensitivity because of the abrasive can open up the pores in the enamel and you'll feel temperature changes a lot more. Now, some of them do contain a peroxide. These guys are more effective and we'll talk about them below, but in general, whitening toothpaste, not very good. Next, we'll talk about the intrinsic staining. So basically, there's certain colored molecules that are found in, say, coffee, tea, red wine, colored fruits, curries. They'll actually embed themselves into your tooth. How the whitening works is the peroxide is actually going to penetrate inside of the tooth, break down these molecules, and take away that color. Now, the longer the peroxide is exposed to your tooth over time and the higher the percentage of the peroxide used, the bigger the effect is going to be. So there's a few ingredients that are used in whitening, but the two main ones that you'll find are hydrogen peroxide or carbamide peroxide. The difference between them is that hydrogen peroxide, it's the active ingredient. So as soon as it contacts the tooth, it'll start working. Whereas carbamide peroxide, it actually undergoes a chemical reaction where it breaks down into hydrogen peroxide, and that's when it will start working. So in practical terms, it means that hydrogen peroxide is going to be more commonly found in the shorter acting solutions, whereas carbamide peroxide, it's more likely to be used in an overnight solution. Now, just so you're aware, when you're looking and comparing products, carbamide peroxide's percentage is going to be 3 times higher than the equivalent hydrogen peroxide. So if you see one that's, say, 18% carbamide peroxide, the equivalent to that is 6% hydrogen peroxide. So make sure you take that into account when you are looking at different products. So now let's talk about different techniques to remove the intrinsic stains. Hey, just a thought while you're watching. If you're getting something out of the video, hit the like button or hit the subscribe button. It really helps me out a lot. The first is peroxide-containing whitening toothpaste. So these contain peroxide in very low concentrations, and because they're only touching your teeth for about 5 minutes per day, their effects are going to be quite minimal. The other downside is that they can result in sensitivity. So I'd almost say steer clear, but feel free to try it out and see if it works for you. Next are the whitening strips. So these are basically an adhesive plastic strip that contains gel on the inside, and you adhere it to the front surfaces of your teeth. Now, most you'll find that they're used for 30 minutes, twice a day, over the course of about 14 days. Now, the research shows that you can actually get pretty good results from using these. The main downside, however, is that because they are one size fits all, they do tend to sit over the top of the gum, which can cause some gum irritation in some patients. But on the positive, they do tend to work, and they are quite affordable, and you can get them over the counter at your local chemist or supermarket. Next up, we have whitening mouth rinses. So these are mouth rinses that you'll use for 1 minute for twice a day, and the idea is they whiten your teeth. Now, the research shows that they do work. It just takes a very long time. It's about 3 months for 1 to 2 shades of improvement, which isn't really very much. I'd be recommending this for someone who's just finished a course of whitening and they want to maintain that shade, compared to someone who hasn't done any whitening before. It's going to take you way too long. Now, I will also say there's a lot of different mouth rinses out there. Make sure that the one that you do buy contains peroxide, because otherwise it's really not going to be giving you much benefit at all. Now, the next are the whitening pens. These are basically a pen with some gel in it that you paint the gel over the top of your teeth. Do not buy these. Now, unless that you can keep your mouth open like this for about an hour, your cheeks and saliva are going to get rid of that gel very, very quickly, effectively making these useless. We had a rep recently come in to give us some samples, and when I asked her about it, basically she said, look, as soon as your cheeks and saliva touch it, it does tend to go away. So the only time they really recommend it is, say, after a night of drinking red wine. You might do it just to try to get rid of the effects from the red wine, but I wasn't really very convinced. So what I'll say is don't buy any of the whitening pens. It's just effective marketing. It doesn't work. So tray-based whitening is the next one. The idea with these is you have these trays that you would then load with gel. You put them over the top of your teeth and then leave them in place for a period of time that's directed by the manufacturer. So these can be purchased over the counter, or you can get them from your dentist. The ones that you get over the counter are going to be a one-size-fits-all. What that means is that you're going to have to use more gel in each, plus the comfort and the fit isn't going to be as good, and you'll have more excess that goes over your gums as well, which can be a problem to the gums if they cause irritation. These over-the-counter ones, typically they'll have a lower percentage of peroxide in them, and they'll also only recommend to use them for about an hour. Now, it's a lower percentage, and they only say an hour. I think that's more to do with if they say to use them for 4 hours, customers won't really be interested in that, so they say to use them for 1 hour, twice a day, but really they're not really going to be that effective. You need to be using them for a lot longer at those lower percentages. The ones that you get from a dentist, they're custom made to your teeth, so the fit's going to be better, the percentage is often a little bit higher, and the outcome is going to be just better in general. The downside to getting them from a dentist is the cost is going to be higher. You just have to weigh up what's more important to you. Now, one thing to note about the ones that you'll get from over the counter is that sometimes they come with a blue activating light. Just know that this is mostly for show. There's very weak research to show that that blue light does anything, and especially when it's powered by this tiny little battery, that thing ain't doing anything. Now, a thing to note about the tray-based whitening is that it's going to take about a week up to about 4 weeks, depending on the percentage that you use, to notice results that you're really happy with. In saying that, some of my patients, especially the younger ones, they've noticed really good results doing it overnight for about 3 days. They're happy, they don't need to do any more. Now, the last one is in-office whitening. This is where you actually go to the dentist and have the whitening done there. For this whitening, they'll use a very high concentration of peroxide, and often they'll use that blue light as well. But like I said, the research, whether that works or not, it's very mixed. So because a much higher percentage of peroxide is used, the results that you do get, they're almost instant, within about 30 minutes or an hour. So they're perfect for that patient that wants instant results. So say you've got a wedding coming up on the weekend, you want to get your teeth really white to look good, or for the patients that don't want to go through the time and the hassle to have to do it at home. Now, the two main downsides to in-office whitening. One is there's going to be a higher cost involved, and then two, it's much more likely that your teeth are going to be much more sensitive because of that high peroxide that's used. If you are someone that has sensitive teeth, I really recommend you against doing the in-office whitening. I'd also recommend that if you do in-office whitening, don't go to a shopping mall or a beauty salon, have it done at a dentist. They're the ones that are best qualified to know that if you are a candidate for this whitening or not. There are certain things that we have to look for to see if a patient is qualified for that whitening. If they're not, we'll say, hey, no, or we have to do these things first. If you go to a place that they're not trained in what to look for, if they don't have the materials and the instruments to know what to look for, you are at risk. So a question that I get a lot, is tooth whitening safe? Now, my answer to this would be yes, as long as it's done correctly. Now, the first risk of tooth whitening is sensitivity. And if it's done incorrectly, it's most likely going to happen to you. Fortunately, there are a few things that you can do to reduce that risk, and I've made a video that covers that in detail. But a few of them include, at the start, don't whiten every single day, don't whiten for the full allotted time, never whiten for more than the recommended time, use some sensitive toothpaste in the time leading up to whitening, and see a dental professional before you start whitening to get the all clear. Now, the next risk is gum irritation. Now, the research shows us that severe reactions are more common with percentages greater than 10% peroxide. Over-the-counter peroxides don't come in this percentage, so the risk is low, but it is still there if it's done incorrectly. This is one of the problems with the one-size-fits-all over-the-counter in-tray whitening, because when you put it on, they don't fit as perfect as they should from a dentist. The peroxide can actually go onto your gums and cause irritation. Now, one tip I do recommend, and this is even for the ones that you have made by a dentist, is when you actually put the trays in place, have a tissue or a toothbrush or something ready to actually get rid of the excess gel that goes over the top of your gums before that irritation starts. And when doing in-office whitening, because they are using such high percentages, what they'll often do is actually put something over the top of your gums just to protect them. Now, the next thing we'll discuss is, can whitening damage your teeth? The short answer is yes, but the long answer is no. Now, when the peroxide does penetrate into the tooth, it does break down the enamel slightly, and we call this process demineralization. This demineralization technically does damage the tooth, and the higher percentage of peroxide that you use, the more demineralization that you will have. Now, the cool thing about the enamel is that it can actually remineralize itself, and it does this with the help of two things. Now, the first thing is from saliva, which actually contains calcium and phosphate, which are the main things that make up enamel. They'll actually embed themselves back into the tooth to cause remineralization. This happens in about half an hour. Now, the second way is with the help of a product that contains amorphous calcium phosphate, like Tooth Mousse Plus, and I'll leave a link in the description below. This is for higher concentration of peroxide where more damage does occur to the enamel, so more likely for in-office whitening. So please make sure that if you are going to do it, do inquire, are they doing any remineralization of the tooth straight after the whitening? Now, the next question is, how safe is the bleach if it is ingested? Now, in short, the answer is it is safe if used correctly. Interestingly, hydrogen peroxide is actually a naturally occurring product inside of our body. However, at higher concentrations, it does actually become toxic to the body. Thankfully, these levels aren't commercially available unless it is directly ingested. Now, the research shows that under 10% hydrogen peroxide, it's only going to cause a mild reaction if you do have a reaction at all. And most of the at-home products are going to be in that category. But there is still a possibility that it can happen. Now, people might get worried and think, well, what if it actually leaks out of the tray and goes down the back of my throat if I'm using a 10% solution? Well, thankfully, our saliva actually has enzymes that will break down that peroxide. So let's just say a little bit leaks out. If it does break down that peroxide, it might take it from a 10% down to a 1%. And if you ingest it at 1%, it's not going to cause any damage to you. Now, we do have to be more careful with in-office bleaching where higher concentrations are used, and that's why we recommend doing it with a dental professional. Now, I will say to make sure that you keep it out of the reach of children, because if they do get their hands on one of those whitening gels and they ingest it, and it is at say 10%, that can cause some damage. So please be careful keeping it out of reach of children. Now, another thing patients ask me is how long is whitening going to last? Now, there's quite a bit of research into this, and the results are actually pretty amazing. Now, there's a few 2-year studies that show that initially there's a shade change of about 8 different shades, which is pretty awesome. And then after 2 years, 90% of those patients only had a regress of 2 shades. So if they went 8, it only came back 2 after 2 years. That's pretty impressive. Now, there's a 17-year study that actually showed that the average patient satisfaction lasted for 12 years after that initial whitening. And I definitely see this in private practice. When a patient comes in, I say, hey, have you done any whitening before? I can tell that they've whitened their teeth. And a lot of the time the answer is, yeah, I did it 10 years ago or 5 years ago. So this does last a really long time. Now, for patients who have a non-white diet, so they have coffee, tea, red wine, dark fruits, for example, there's this myth going around saying that you shouldn't whiten your teeth because it's going to get worse. This is not true at all. It's been shown that it does not actually interfere with the whitening. Now, what you will find is that for these patients, it's going to darken afterwards at a faster rate than for someone else, but it's not going to make it any worse. Now, what I do suggest to these patients is rather than continue as you are and having yellow teeth that you really don't like, whiten your teeth. Know that they are probably going to darken or go a little bit more yellow faster than someone who's not doing those things. But when it gets to that point, you can just top up. So let's say that you're doing the at-home whitening, you've got the trays and the gel. When you notice that it changes, just do like another couple of days of whitening to bring it back to that level. Or you might want to use one of those whitening mouth rinses to actually just maintain that color. Some people also find they sip through a straw, but I think that looks a little bit strange if you're drinking coffee or red wine. But there is hope for you, so don't listen to the people that tell you to not whiten your teeth. Next, I want to talk about the protocol for take-home whitening. So first thing, you want to brush your teeth and you want to give them a floss. Make sure that they're very clean and the gums are clean too. Now, if you've got a customized tray from a dentist, you really don't need very much gel at all because it adheres to the tooth so tightly. So the amount that you're going to be using of the gel is the size of the head of a matchstick. So you put it in each little spot on the outside surface. Now, I don't recommend whitening all of your teeth. Smile in the mirror, see how many you can actually see when you smile. For me, it's about the top 10 and the bottom 8. If you whiten all of them, you run out of your gel faster. So only whiten the teeth that you can actually see. So load up the trays and then put them in, get the tissue ready, and then take away that excess. After the allotted time, you take them out. Give your mouth a good rinse, and then brush your teeth, but be very, very gentle. You don't need to brush long, it's just long enough to remove the whitening gel. If you give them a proper brush, because your enamel is still a little bit soft, you can actually wear away the enamel, so be careful that you don't brush for too long, just enough to get the whitening gel away. Now, the last thing to mention is that if you have any dental restorations, like fillings, crowns, or veneers, these aren't really going to change color. So if you do whiten your teeth, you may notice now that these stand out because they're a slightly yellow shade because they match to what your teeth were before. So bear this in mind before you start whitening. It might be something that when you finish your whitening, you may feel like you do want to change those over. This is something to chat about with your dentist. So to summarize, whitening is a safe procedure when it's done correctly, and it's a great way to improve your smile. What would be the regime that I'd recommend? Well, if you don't need immediate results and you're happy to wait a couple of weeks, I'd say do take-home whitening provided to you by a dentist. Minimize sensitivity by using some sensitive toothpaste before you start, and take the process slowly. Now, within approximately 14 days of whitening, maybe even less, you'll notice some pretty significant changes. Now, for those that want immediate results or you don't want to do at-home whitening, do in-office whitening. It's a great way of getting those quick, good-looking results. To maximize the benefits from in-office whitening, also combine it with take-home whitening as well to get the maximum whiteness out of your teeth. Now, for those that are on a budget and want to buy something over the counter, I think that actually whitening strips are probably the best way of doing it. You put them over your teeth, you leave them in there, you don't have these uncomfortable trays that don't really fit properly. Just be careful with gum irritation with the whitening strips. If you do get that, maybe cease using them. Now for long-term maintenance of colour, you can simply top up again in a couple of months' time of your take-home whitening, or you can use a peroxide containing whitening mouth rinse a few times per week. Now it should also be known that avoiding coloured foods is not necessary, but having these things after whitening can actually speed up the process that they are going to darken. But all that means is that you just whiten again in a couple of months if you do notice that the colour does change. And drinking through a straw can actually help in this case. Anyway guys, thanks so much for watching. I hope you got something out of the video. If you did, please like, share, subscribe. Those things really help me out a lot. And if you've got any questions, put them in the comments section. I'll make sure to answer them for you. Have a great day. Keep on smiling.